And this is to not only show you scatter plots, but also something that resembles the actual brain work. But I really don't have anything to say to this, rather than it's a nice moving hippocampus, which was taken from a typical MRI. What now adds to the story and makes it specific to be reported here is that when we started to include women a couple of years later, we suddenly saw that this link between hippocampal volume and self-esteem is present only in men. So this is the self-esteem hippocampal volume for total hippocampal volume, left and right combined, as we saw it in another study, and this time we look at men and women separately. There is this positive linear correlation, again, between the two. But when we look at the women, the brain personality link in women, self-esteem and total hippocampus, we basically get a cloud of points, and there is no relationship between the two. So this was very surprising. We hadn't had any prior hypothesis to this association, and I don't think there are many studies that show systematic investigations of self-esteem differences between men and women, but this was something that added to our understanding or to our knowledge about this personality trait-brain relationship, that the self-esteem correlation at least seemed to be specific to men. However, and this is work by a former PhD student in the lab, Claudia Buss, who is now at Patrick Wadwa's lab in Irvine, California. We found a link of hippocampal volume with maternal care and birth weight in the women. So when looking at possible other variables that might link to hippocampal volume in women, we did find something, and that was maternal care in the combination with birth weight. So it's not quite as straightforward a story, but basically what you see is that in women that have self-reported low maternal care during the first 16 years of their life, there is a significant positive correlation between birth weight and hippocampal volume, as you can see here, in the sense that if you understand or if you assess birth weight as a proxy of prenatal risk factors and prenatal adverse events, then you do see that this has an effect on the adult hippocampal volume if maternal care was also low. So if maternal care is high, it can basically neglect and negate this effect of birth weight on hippocampal volume in adulthood, but it doesn't seem to have any effect in men. So once you look at men, nothing of the previously seen relationship between birth weight, maternal care, and hippocampal volume seemed to stand. So this gave us the picture of self-esteem hippocampal volume in men and birth weight, low maternal care relationship in women. So when we try to wrap our heads around this and try to understand what this could possibly mean, you can start to ask yourself whether self-esteem might be a more achievement-related personality trait, and whether then other measures might be more related to the female brain. And looking back at the way we did that, to typically assess self-esteem, our most robust measure of correlation between personality and brain morphology was not self-esteem as a whole, but one of the subcomponents of self-esteem, which is locus of control. And then if you think about what locus of control is, it's assessed, or it's defined as feelings of personal competency and control. So you can see how there is perhaps more a relationship to the achievement type task that we have previously seen that seem to be specific to trigger a stress response in men. Whereas if you think about what maternal care is, it's of course associated with emotionality, understanding, and friendliness. So it goes away from personal achievement and personal competency to perhaps more the socialization and social integration with your environment more. So I'm almost at the end. What I would like to close with is to give you a little bit of an outlook of what we're currently busy with in the lab to try and better understand this relationship between sex and gender and stress response and the brain, which I think has a very promising lead so far, but needs to be thoroughly investigated. And I'm very happy to say that we're actually doing this with the support of a CIHR grant from the Institute of Gender and Health. So when we try to systematically study that, we want to look at 240 young adults, men and women, 120 each, in young adulthood, and we want to pre-screen them for gender identity in groups of 60 each, and to basically contrast men that are very much gender identical to men and men that seem to be very low in their male gender identity, so they would be atypical. Of course, they are harder to find, so we need to pre-screen many more than the original 240 to, in the end, have 60 in each group, which are very high and very low in their gender identity. And we would do the same for the woman. And we would then take all of the usual suspects that we have previously employed that have shown these gender and sex differences. So we'll look at self-esteem, locus of control, neo-FFI, neuroticism, certainly one that has been mentioned in the literature a lot, and that might have to do with revealing or explaining some of this difference in worrying and emotionality. We'll combine that with endocrine assessment and neuroimaging assessment. The endocrine assessment will look at the diurnal rhythm of the HPA axis, cortisol response to awakening, and then at 4, 6, and 9 p.m. on 3 independent days, at least 2 days apart, to give you a good capture of a baseline HPA axis activity. We'll look at gonadal hormones at the same time to see whether or not the sex hormones have an effect in there, and then we will do repeated stress testing, probably not more than 2 times, to assess the HPA axis reactivity to these different types of stressors, and a more achievement type stressor versus a more social type stressor. And we are currently in the process of trying to identify what are the best types for these types of tasks, to see what gives us the best and most robust stress responses. And then finally, for the neuroimaging, we will put a selection of those 240 subjects, because you couldn't really afford to scan 240 subjects, but we'll put a selection of those in the scanner to then also allow us to assess structural neuroimaging parameters like the hippocampus and prefrontal cortex areas. And we would also use functional MRI with the functional stress tasks that we have developed to assess differential responses to stress in men and women. And just to conclude with that, we did see differences between responders and non-responders before, which seemed to have a strong differential effect in the mostly limbic, orbitofrontal, medial orbitofrontal, and medial temporal lobe areas of the brain, where the stress responders show a stronger, much stronger deactivation, which is basically absent in the non-responders. But revisiting that data to look at gender differences, we also saw that it's a similar pattern for men versus women. So there also seemed to be a strong presence of gender differences in the functional MRI results, which of course is interesting to look at. So to conclude, I would suggest that the systematic assessment of the consequences of sex and gender on psychological, endocrinological, and neuroimaging variables is possible and viable, as we will hopefully be able to do this in the next number of months and years, and that these investigations of variables will allow us to better explain the differential first endocrine, but then in the long term also health effects that are well documented in the literature. And I couldn't end without giving special thanks to the agencies that fund this research, CIHR, the Alzheimer's Society of Canada, and NSERC, and then of course also to the people in the lab, the graduate students, the volunteers, and the other assistants, without which none of this work would be possible. And yes, this is our weekly lab meeting, and there's wine and dinner all the time. Thank you very much for your attention.